Welcome back. We're going to start with some breaking news because the King has been seen entering a private London clinic in the last few minutes ahead of his prostate surgery. Our Royal Correspondent Cameron Walker is in the studio to bring us the latest. What do we know, Cameron?
So we know the King left Clarence House this morning accompanied by Queen Camilla, and then he was seen arriving at the London clinic, the private hospital where the Princess of Wales is currently recovering from her abdominal surgery a couple of weeks ago, and he was seen entering the building with Queen Camilla as well. Now, what we don't know is whether their Majesties are visiting Catherine, the Princess of Wales, or indeed the King is entering the hospital to receive treatment for the enlarged prostate. If you remember, we were told that he was due to have treatment on an enlarged prostate at some point this week. Buckingham Palace have not confirmed if that has happened yet. Of course, we can point to the fact that, of course, he's entering hospital the first time he has done so since that news was broke by Buckingham Palace. But the fact is they're not saying anything at this moment. But what we do know is the King has entered the London clinic this morning. One
question I just wondered is, would there not be a security risk by them both having treatment at the same hospital? It's like when they wouldn't both fly on the same plane.
Quite possibly. We know that the London clinic is heavily guarded. Police have been outside the doors ever since the Princess was admitted a couple of weeks ago. I think it's with any building, really. There are several members of the royal family in royal palaces at any one time, or indeed Westminster Abbey, for example. Of course, the London clinic it is well used to, as well as King Edward VII, treating high-profile patients, and that, of course, is perhaps what is happening here. Or the King and Queen could just be visiting the Princess, who is still recovering in that hospital.
And what is the standard practice of Buckingham Palace? Would they prefer that a surgery were to take place and then they release a statement afterwards just saying everything seems to be OK? Because that's what we saw with the Princess of Wales, didn't we, after her abdominal surgery? Yeah,
exactly. I suspect Buckingham Palace are staying very silent at the moment. I suspect they would tell us post-events what the King's condition is and what he has had done. Of course, we didn't hear about the Princess of Wales, as you said, until the surgery had happened. But what I would say is it's incredibly rare, as we spoke at length last week, for the King to give quite such detail as to the kind of medical procedure he's having done. So, for example, the fact he's told us that he's having a treatment for an enlarged prostate is incredibly rare. They usually keep medical details private. And he wanted to encourage others to seek treatment if they have... Oh, we have just received a statement from Buckingham Palace, so I'm just going to get it up on my phone. So a statement from Buckingham Palace. The King was this morning admitted to a London hospital for scheduled treatment. His Majesty would like to thank all those who have sent their good wishes over the past week and is delighted to learn that his diagnosis is having a positive impact on public health awareness. So there we are. Buckingham Palace has confirmed the King has been admitted to a London hospital for that treatment. They also say that he wishes to thank those for their good wishes over the past week and is delighted that his diagnosis of an enlarged prostate has had such a positive impact on public health awareness. Of course, we heard that the NHS website had exploded when it came to people looking
which shows how very different approach he's taking to his reign compared to his late mother. Do we know how long he's going to be having treatment for?
We don't know 100%. We expect it to be a couple of days at least. I think the guidance from Buckingham Palace when they first told us about the King's health diagnosis was that he's going to be out of action for a little bit of time. His public engagements in the interim have all been cancelled or at least postponed. It seems less serious than the Princess of Wales's hospital treatments because she, of course, is expected to convalesce for at least 3 months. We're not expecting to see her until at least Easter on public engagements. The King is going to be a much shorter amount of time, but they haven't put an exact date on it because, of course, you never know how an operation is going to go.
No, of course. And what will this mean for the royal family? We now have confirmation that the Princess of Wales and King Charles are both in hospital.
Indeed. Well, it's easy for Prince William because he can visit his father and his wife at the same time. I think the London Clinic is a very prestigious, it's one of the best places you can get medical care. I think, of course, it's a private hospital very close to King Edward VII, which is known for treating members of the royal family over the years. In terms of the royal family, it's only Queen Camilla, who is senior royals, who is carrying out a big public engagement at the moment. We have the Princess Royal and other less senior members of the royal family continuing and holding the force. But of course, it does mean a lot of them are out of action at the moment. And Queen Camilla is with the King, because we saw her entering the hospital with His Majesty this morning. So at the moment, no senior royals are carrying out any public engagements.